Welcome back to our video series. For those of you who have been following me, and for those of you who are watching for the first time, my name is Leslie McEwen. I'm a registered psychotherapist, and I work on gender-based violence. And today I want to look at how it affects one's mental health. It is known that it has a negative impact on the mental health. Some ways it impacts is by depression, anxiety, low self-esteem, etc. However, today I will be looking at symptoms of depression. I want to begin by saying it's not all in your head. Depression symptoms are physical, they're feelings, and they're cognitive, affecting the way you feel, affecting the way you think, and affecting your mood. Now, a lot of times, individuals have been made to feel that it's all in your head, and especially women. But I want you to bear this in mind. These are the depression symptoms, and they're real, and they're not just in your head. Different cultures may understand, experience, and report depression in a different way or in different ways. Now, studies have shown that Black women and girls are more likely to experience psychosomatic, or in other words, physical symptoms when it comes to depression, anxiety, etc. Black women with mental health conditions like depression or anxiety will report a higher rate of headaches, muscle tension, aches and pains, and gastrointestinal problems. Although everyone experiences depression differently, certain feelings and behaviors are common among all. Mood, for example, irritability, anger, those are some of the feelings. You may feel empty or feel sad or be anxious or have feelings of hopelessness. Behaviors such as a loss of interest in your daily activities, withdrawing socially, having thoughts of suicide, those are some other ones. Cognitive abilities such as the way you're thinking, maybe slowly or not clearly. Sleeping patterns are affected. You're not sleeping through the night, you're not sleeping enough, you're waking a lot, you can't fall asleep, or you fall asleep, but you can't stay asleep. Those are all symptoms. Now, decreased energy, greater fatigue, changes in your appetite, weight changes, and as I said before, aches, pains, headaches, increased cramps, etc. Those are all some symptoms of depression. To pull the two previous slides together, cultural aspects significantly influence how depression is understood, experienced, and expressed across different societies. It's important to recognize that what is considered a typical presentation of depressive symptoms can vary greatly depending on cultural norms and beliefs. In some cultures, emotional symptoms like sadness might be more openly expressed, while in others, physical symptoms like fatigue or body aches might be the primary way depression manifests. Additionally, the stigma associated with mental health can vary widely, impacting whether individuals feel comfortable seeking help or discussing their struggles. Cultural values also shape how people cope with this stress and what kind of support systems are available or preferred. I want to be clear that only a doctor, a psychologist, or a psychiatrist can make an official diagnosis of depression. If your symptoms are affecting the quality of your life, please speak to a safe person, a family member, someone that's close to you that you trust, or seek professional help, or speak to your clergy. For a lot of people, their spiritual life is important, so take advantage of that aspect of your life if it's safe for you to do so. Remember, there's no shame in taking care of your mental health. It's not all in your mind. Make your mental health as important as your physical health. If you're in crisis or fear that you're in danger of harming yourself or anyone else, please call the Canada Suicide Prevention Service, and the number is 1-833 456 4566, or dial the emergency number 911. Take care of yourself, be safe, and remember, it's not just in your head. This video is for educational purposes only and is not a substitute for professional mental health advice. I may not be speaking to you from your region or country or city, but wherever you are, if you're not sure where to start, here are some tips. Speak to a trusted friend or family member or your clergy. Contact a crisis line if you're in immediate distress. Do a search online for mental health resources in your city. Reach out to your family doctor for guidance. Remember, you're not alone. Help is available and you deserve to access it. Again, this video is for educational purposes only and is not a substitute for professional mental health advice. If you found this video valuable, please like, share, comment, and subscribe to my channel at Leslie McEwen. Thanks for watching.